What the study says.
Do you pop a daily vitamin hoping it's your personal health shield? You might be surprised, maybe even a little shocked by what the latest robust research actually says about those little pills. Today, we're peeling back the glossy label on your supplement bottle. Welcome back to What the Study Says, the deep dive into the science behind your everyday health choices.
I'm Dr. Kai.
And I'm Dr. May. Today, we're taking a deep dive into the fascinating and often pretty surprising world of vitamin supplements. Are they the health panacea so many people believe? Or are we, just creating very expensive urine?
Well, maybe a bit of both sometimes.
We'll be analyzing the latest studies to help you understand if you really need to take vitamin supplements, and if you do, which kinds. We'll try to keep it clear, actionable, and maybe even a bit entertaining.
Okay, let's get into it. So first, maybe just a quick refresher. What exactly are vitamins? They're these unique organic compounds, essential in really tiny amounts for our bodies to function normally.
Yeah.
For everything from energy production to, building bones.
Right. And the fascinating thing is, most of them our bodies can't actually make on their own, so we absolutely have to get them through our diet, mostly.
Mostly, yeah. There are a few clever exceptions, though. Your skin, for example, with a little help from UV light, can synthesize pre-vitamin D. And, believe it or not, certain microbes way down in your colon can actually produce vitamins K2 and B12.
So while most come from your food, like that plate of kale, not everything comes from the plate. And just to be clear, we're talking vitamins here. They're organic compounds, different from minerals like, say, calcium or iron.
Exactly. Now, while a balanced diet usually covers most people's needs, there are definitely specific situations that can significantly ramp up your requirements.
Like what sort of situations?
Well, think about pregnancy or lactation. Huge demands there. Or if someone has chronic alcohol consumption. Even long-term use of certain medications can actually increase your need for particular vitamins.
Okay, and this leads us to maybe one of the biggest misconceptions out there. The idea that popping a vitamin supplement is going to prevent or even reverse chronic diseases like heart disease or cancer.
Yeah, that idea. Well, for most chronic diseases, it's largely been disproven in most cases. And maybe more concerning, in some situations, it's even proven to be actively harmful.
Right. This is where there's a real gap between what people think supplements do and what the rigorous science actually shows.
And a big part of that confusion comes from the difference between observational studies and randomized trials. Observational studies might notice an association like, hey, people who take supplements seem healthier.
But that doesn't prove the supplement caused it, right?
Exactly. It's just a link. When you put it to the test in a randomized controlled trial, which is really the gold standard for proving cause and effect, those supposed benefits often just disappear. It's also worth mentioning that some older studies had, let's say, methodological issues, like not properly checking people's baseline vitamin levels or using wildly different doses, sometimes pharmacological doses.
Makes sense. So we've kind of moved beyond the really dramatic deficiency syndromes like scurvy from no vitamin C or pellagra. You still see those, tragically, in parts of the world with very limited food access.
True. But in resource-rich societies like ours, when we do see deficiencies, they tend to be in pretty specific groups.
Okay, so who is at risk in places where, generally speaking, food is abundant?
Well, we're talking about maybe some older adults because absorption can decrease with age. Vegans, obviously, if they aren't careful about certain nutrients like B12. New immigrants might arrive with deficiencies, people experiencing poverty, sadly. Also, those with alcohol use disorder, conditions causing malabsorption like Crohn's disease, or people with very limited sun exposure.
What about after surgery?
Yeah, a history of bariatric surgery is a big one.
Yeah.
And folks undergoing hemodialysis or receiving all their nutrition intravenously.
But here's a crucial point. You mentioned just having low levels in your blood doesn't always mean you have an actual deficiency that needs treating, right?
Precisely. An underlying illness can sometimes mess with those levels without it meaning you need more of that vitamin from a pill. The body's complex.
So how do we figure out what's optimal intake? And should we all be running out to get tested? We hear about the RDA.
Right, the dietary reference intakes, or DRIs. The recommended dietary allowance, the RDA, is usually our main guide for clinical purposes. It's the daily intake level sufficient to meet the nutrient requirements of nearly all, like 97, 98% healthy individuals. But when it comes to routine testing for vitamin deficiencies in generally healthy adults, it's usually unwarranted.
Why is that?
Well, partly because we often don't have super clear data on what truly defines an optimal blood level for every single vitamin. So the results can be hard to interpret if they're just slightly low. And more importantly, there's often just no strong evidence that supplementing healthy adults who have slightly low levels actually prevents disease unless they fall into those specific risk categories we mentioned.
So testing is okay sometimes.
Oh, absolutely. When a deficiency is genuinely suspected based on symptoms or clinical picture, or as part of evaluating something specific like measuring vitamin D if someone has osteoporosis, or checking B12 if someone has cognitive decline, and we don't know why.
Okay, that clarifies things. Let's dive into some specific vitamins then. Maybe start with vitamin D. It's huge, the sunshine vitamin, the bone builder.
It is huge. And its proven role is primarily about bone health, maintaining or promoting bone density, decreasing fall risk, especially in, say, postmenopausal women who aren't getting enough calcium and vitamin D from their diet. There also might be a role, some emerging evidence suggests, in potentially preventing type 2 diabetes in patients who already have prediabetes. That's quite solid.
But here's the kicker, right? The big sort of disappointment for many. Observational studies link low vitamin D to everything else: increased mortality, cancer, autoimmune diseases, heart problems, even dementia. It sounds like a miracle cure.
It sounds like it. But despite those strong observational links, the key finding from rigorous testing is this. Randomized trials have repeatedly not demonstrated a benefit for vitamin D supplementation in preventing these broader conditions.
So, bottom line for vitamin D.
Don't expect that pill to be your universal health shield beyond its established bone benefits and maybe that prediabetes angle. The hype, unfortunately, has outpaced the high-quality evidence for most people.
Okay. What about the antioxidants? Vitamins A, C, and E? The idea was always they'd fight those nasty free radicals, prevent cancer, heart disease.
Yeah, the hypothesis sounded great. And it is true that diets rich in antioxidants, lots of colorful fruits and vegetables, are associated with lower risks of cancer and cardiovascular disease.
But the benefit might not be the vitamins themselves in isolation?
Probably not just the vitamins. It's likely the whole package. All the other beneficial compounds in those foods, maybe the fiber, maybe the fact that a diet high in fruits and veggies often means a generally healthier lifestyle overall, or simply that you're eating those instead of, junk food.
And the crucial part for supplements.
Here's a really important bit, maybe even shocking for some. There's essentially no role for antioxidant supplements in preventing these major diseases. We simply do not advise taking vitamin A, C, or E supplements strictly for cardiovascular disease or cancer prevention.
Wow, no role at all.
Expert panels like the USPSTF found insufficient evidence to recommend for or against vitamins A or combinations for heart health. But critically, they actually recommend against taking beta-carotene or vitamin E supplements specifically to prevent cardiovascular disease or cancer.
Against. Not just neutral, but actively against.
Actively against for beta-carotene and vitamin E in that context, yes. And randomized trials have consistently found no reduction in cancer risk with these antioxidant supplements. And it gets even more concerning when we look closely at vitamin A and the related compounds, carotenoids. Well, you get retinol from animal products and provitamin A carotenoids from things like carrots, sweet potatoes, leafy greens. But routine supplementation in well-nourished populations like ours, it's just not warranted. There's a lack of proven benefit, and worse, there's a real possibility of harm.
Harm from vitamin A.
Yes. This is totally different from the situation in resource-limited countries where vitamin A deficiency is a major cause of blindness and death in children, and supplementation there is life-saving. But here, it's a different story.
So this isn't just about wasting money on pills that don't work.
Exactly. We're talking potential active harm. For instance, taking beta-carotene supplements was found to increase lung cancer risk in high-risk men, specifically smokers, and those exposed to asbestos.
Seriously? Increased risk?
Increased risk. Now, the good news is that the excess risk seemed to disappear once they stopped taking the supplements. But still, there's also data suggesting an increased risk of prostate cancer incidence and mortality with beta-carotene. High retinol intake, even just from diet if it's really high, is a risk factor for osteopenia, which is weaker bones, and fractures in postmenopausal women. So if you eat a lot of liver or take cod liver oil already, you should definitely avoid extra vitamin A supplements. And for pregnancy, taking high doses over 10,000 IUs a day of preformed vitamin A in the first trimester increases the risk of birth defects. It's teratogenic.
And no benefit for eyes, like cataracts?
Nope. No proven benefit for cataracts or macular degeneration from supplementation either. The take-home is, your body handles nutrients from food way better than megadoses from pills, which can seriously backfire.
Okay, let's switch to vitamin C, famous for colds, right? Found in citrus, peppers, tomatoes.
Right. But unfortunately, despite its fame, there's no good evidence to support using vitamin C supplements for preventing chronic diseases like cancer or heart disease.
And the common cold, that massive dose everyone takes when they feel a sniffle coming on.
Yeah, about that. Randomized trials show pretty clearly no evidence that taking vitamin C regularly reduces how often you get colds.
So it doesn't prevent them. Does it shorten them?
There's maybe some very weak evidence it might slightly shorten duration in some people if taken consistently. But for the average person taking it just when symptoms start, probably not much effect.
And any downsides?
Well, while it's generally safe, very high doses can increase oxalate in your urine, and that may increase the risk of kidney stones in susceptible people.
So that giant fizzy vitamin C tablet.
It's likely doing more for your toilet bowl chemistry than your immune system, and maybe, just maybe, giving your kidneys extra work. And again, no benefit shown for cataracts or macular degeneration.
All right, now vitamin E. This one sounds like it might be even more problematic.
This is where the story gets, a bit darker. You find it naturally in vegetable oils, nuts, leafy greens. But supplement-wise, the science is really clear. No support for preventing or treating cancers, heart disease, dementia, or infections.
Okay, no benefit. But is there harm? You mentioned harm earlier.
Yes, this is serious. High-dose vitamin E, we're talking 400 international units daily or more, might actually increase all-cause mortality.
Wait, increase the risk of dying? From a vitamin?
That's what some large meta-analyses suggest. It's shocking, I know. Plus, it can increase the risk of hemorrhagic stroke that's bleeding in the brain. And if you're taking anticoagulants, blood thinners, like warfarin, you should absolutely avoid high-dose vitamin E because it can amplify the blood thinning effect, increasing bleeding risk.
Wow. Any effect on infections?
Trials in older adults found no reduction in respiratory infections. In fact, sometimes supplementing led to more symptoms and longer illness duration.
So the message is really clear for vitamin E supplement.
Extremely clear. Avoid high doses. Get it from food. This is probably the starkest example of how something marketed for health could potentially backfire. Whole foods are almost always the safer bet.
Let's move to the B vitamins now. A whole group of them. What's the general picture there?
Right, B vitamins are crucial. They're involved in DNA synthesis, nerve function, countless metabolic pathways. But while they've been proposed to help prevent things like heart disease, dementia, cancer, osteoporosis, these roles have not been clearly established in large randomized trials for general prevention.
What about those B-complex supplements people take with folic acid, B6, B12? They lower homocysteine, right?
They do lower homocysteine, which is an amino acid linked to heart disease risk.
Oh.
But, and this is key, lowering homocysteine with these B vitamins in trials has not translated into preventing heart attacks or strokes, especially for secondary prevention. The evidence just isn't there.
And dementia.
Results there have been pretty conflicting. No clear consensus that B vitamin supplements prevent cognitive decline in the general population.
Okay, so looking at individual Bs, B2, riboflavin.
Found in lots of foods, milk, meat, eggs. No strong evidence it's needed as a supplement for healthy people eating decently. It might have a role in helping with episodic migraines for some individuals, but that's specific.
B6 pyridoxine.
Higher levels in the body are associated with lower cancer risk in some observational studies. But again, when they tested supplementation in randomized trials, no demonstrated benefit for cancer prevention.
Then we get to B9, folic acid or folate. This one's different, isn't it?
This one, different. Hugely important. First, let's distinguish. Folate is the natural source in fear, leafy greens especially. Folic acid is the synthetic form in supplements and fortified foods like cereals and bread.
And the big benefit.
It's absolutely well established and a massive public health success story. Folic acid supplementation significantly reduces the risk of neural tube defects in developing babies during pregnancy, things like spina bifida.
So this is crucial for
women who are or might become pregnant. The standard recommendation is 400 micrograms daily for all women of childbearing potential, and sometimes higher doses if there are specific risk factors. This is non-negotiable, evidence-based prevention.
But beyond pregnancy, for general health, cancer, heart disease?
That's where the magic kind of fizzles out again. Observational studies hinted at benefits, but randomized trials have not confirmed benefits for cancer or heart disease prevention. In fact, some studies raise a slight concern, the possibility of harm, regarding folic acid in certain cancers, although this is still debated.
Any other downsides?
There's some association between very high folate intake and peripheral neuropathy nerve damage in some older individuals, particularly if B12 levels are also low, so more isn't always better, even here.
Okay, and finally, vitamin B12, cobalamin.
the vegan's best friend, often called that. Its main sources are animal products, liver, milk, fish, meat. So deficiency is often caused by poor absorption, which gets more common as we age, or in people taking the diabetes drug metformin, or those with alcohol use disorder. And of course, inadequate intake is a major cause for vegans and some vegetarians if they aren't supplementing or eating fortified foods.
What happens if you're deficient?
It can cause serious problems. Neuropsychiatric issues, memory problems, confusion, depression, and a type of anemia called megaloblastic anemia.
So who should consider testing or supplementing?
It's very reasonable for at-risk individuals. Definitely vegans, long-term metformin users, people with alcohol use disorder, those with known absorption problems, or even some older adults with poor diets.
Is B12 safe to supplement?
Generally, yes. It's very well tolerated even at higher doses, with no significant proven adverse effects from supplements or fortified foods. A standard multivitamin or a specific B12 supplement is a good idea for those groups. This isn't about chasing a health trend, it's about preventing genuine, serious deficiency. So after running through all those individual vitamins, what about the catch-all, the multivitamin?
Right, the daily multi. Lots of people take one just to be safe. What's typically in them?
Usually they contain a range, maybe 50 to 100 to 50% of the RDA for many different vitamins, sometimes minerals too.
And the appeal is obvious, right? Seems effective, seems safe, low cost, convenient. Just pop one pill.
Totally. The appeal is strong. But what does the evidence say? Our approach, which mirrors what major expert bodies like the USPSTF recommend, is this. For otherwise healthy people who eat a reasonably adequate diet and don't have specific risk factors for deficiency, we generally suggest not taking a multivitamin specifically for the purpose of preventing chronic diseases like cancer or heart disease. Why? Simply because there's insufficient evidence of a clear benefit for primary prevention in that large group.
But you're not saying people should absolutely stop if they feel better taking one.
No, we don't strongly discourage patients who want to take one provided there's no specific reason not to, like maybe avoiding extra vitamin A if they already have high intake. But we do think multivitamins are appropriate and often necessary for those patients who are genuinely at risk for deficiency, the groups we mentioned before. Alcohol use disorder, very poor diets, malabsorption, vegans, post-bariatric surgery patients, etc.
Okay. And in terms of actually preventing the big killers, mortality, heart disease, cancer, what have the big multivitamin trials shown?
Pretty consistently, little or no benefit. Most large studies haven't found that multivitamins prevent cancer, cardiovascular disease, or overall death in the general population. There were a couple of trials that showed maybe a small reduction in cancer incidence, not death, in men, but others found no effect. It's inconsistent at best. And no clear benefit for preventing cognitive decline either.
And safety. Are the doses in a typical multi safe?
Generally, yes. The individual vitamin doses in most standard multivitamins are within safe limits for most adults.
But you can still run into issues with high doses, even from multis sometimes.
You can. Some high-potency multis might contain levels of certain vitamins, like A or E, that could pose risks. We discussed hip fracture risk with high A, potential mortality increase, or stroke risk with high E. And sometimes very high B12 levels, while not typically harmful, might be unnecessary. And we mentioned vitamin C in kidney stones.
So toxicity is still a concern if people take too much, maybe combining a multi with individual high-dose supplements?
Absolutely. It's easy to reach potentially toxic levels if you start taking multiple high-potency pills. Remember, water-soluble vitamins like C and B vitamins, except maybe high C in kidney stones, are generally tolerated better, with toxicity usually only at really massive doses. But the fat-soluble ones, A, D, E, K, build up in the body and are generally more toxic at lower multiples of the RDA. We covered the specific risks for A, liver, nerve, birth defects, D, high blood calcium, and E, mortality bleeding.
Okay, just to wrap up on special diets again, vegans.
Definitely need B12. Should strongly consider vitamin D, especially depending on sun exposure and location, maybe iodine and iron depending on their specific diet.
Other vegetarians?
Lacto-ovo or lacto-vegetarians should also think about B12, as intake might still be low. And generally, anyone restricting entire food categories or eating a very monotonous diet might be at risk for certain deficiencies. In those cases, a daily multivitamin could be a reasonable safety net, or specific testing might be warranted.
Okay, so let's try to boil this all down. What's the big takeaway from our deep dive today?
I think the main message is, for most healthy people, eating a reasonably balanced diet with fruits, vegetables, whole foods, that diet is your best source of vitamins. Supplementation is rarely the magic bullet for preventing major diseases that it's often marketed as. And in some significant cases, particularly with high doses of certain vitamins like A and E, it can even be harmful.
But it's not all negative, right? There are clear cases where supplements are crucial.
Absolutely vital. For specific populations, pregnant women needing folic acid is the prime example. Vegans needing B12. People with diagnosed deficiencies or absorption issues, supplements are essential, backed by strong evidence, and make a huge difference.
So it's about targeted use, not just a scattergun approach hoping for the best.
Exactly. It's not about chasing a vague health halo. It's about preventing specific serious deficiencies or supporting health during particular life stages like pregnancy.
So maybe a final provocative thought for our listeners.
Maybe the next time you reach for that supplement bottle, just pause and ask yourself, am I truly filling a specific known gap in my diet or health based on evidence or medical advice? Or am I maybe just hoping for an easy shortcut to wellness that the science doesn't really support?
That's a great question to ponder. We really hope this deep dive helps you make more informed decisions about your own health and supplement use. If you found this information valuable, please do hit that subscribe button, maybe share this deep dive with your friends and family who might be wondering about vitamins too, and join us next time on What the Study Says.